my name's Nicole Stanbolgis. I'm a third year Bachelor of Nursing student at Swinburne University. I've always had a keen interest in healthcare, the process of disease and social determinants of health. Nursing interested me because I saw it as such an important and purposeful role to be part of a team of healthcare professionals who were involved in improving somebody's health outcomes, so whether that be in the community or in the hospital setting. So things like using suction to remove mucus to help someone immediately be able to breathe easier, to being that person that turns up, to educate somebody after they've been given a life-threatening diagnosis that they know nothing about, to being that person who can confidently give basic life support in the community, or to being that person who has the privilege of being able to go out to under-resourced rural communities to deliver healthcare services. Having these skills to be able to do these things and more when somebody is at their most vulnerable, I see as such a privilege and rewarding thing to be able to do. Nurses have the unique opportunity to make a person's experience so much better. So when I combine my strong interest in pathophysiology as well as being able to use that in practice by transferring it into a skill, was the reason I saw nursing as the perfect career choice. I was also really excited by how many opportunities and roles nurses can pursue, such as education, advocacy, leadership or research, and how many different disciplines there are to specialise in as well. There's so much variety and so much opportunity to choose from. I'm currently practicing as an enrolled nurse. Furthering myself to become a registered nurse was the next progression in my career as an enrolled nurse, to be given these opportunities. One component of nursing that particularly interests me is the role of the nurse as an educator. So one career aspiration I have is to become a clinical nurse specialist in a chosen field, which will give me the opportunity to be involved in providing nursing education at the Alfred. This relates to the graduate position, as I will need to be working in the chosen discipline to understand and gain experience in seeing how the disease impacts a person, as well as up-to-date treatment options, so that I can provide specialist education in this field. To achieve this position, I will need to commence working as a registered nurse, which is a prerequisite for being accepted to postgraduate studies. The second component of nursing that interests me is leadership. Therefore, an aspiration that I have is to be successful in obtaining a management role at the Alfred. This aspiration directly relates to the role, as I will need registered nurse experience in an acute setting, so that I am able to make management decisions that are safe and derive from my own best practice experience of providing nursing care. One challenge that I experienced on student placement was when one of my patients had a PEG tube inserted the day before, and they were in hospital so they could receive education on this. In the morning, I attended to their physical obs and I left the room. After some time, I re-entered the room, and as I was talking to them for a lengthy period, we both noticed there was a considerable amount of blood from the site. I immediately called my buddy nurse for assistance, who instructed me to do a set of obs on her, which I did. I was able to recall her results from the previous set of obs, and I informed my buddy nurse that there was now a significant drop in her blood pressure and increase in her heart rate from the previous set, and subsequently a Met call was made. Shortly afterwards, the room filled with doctors. However, at this stage, no nurses other than my buddy were present, who was preoccupied compressing the wound to stop the bleeding as I stood watching. The doctors were instructing me to commence IV fluids immediately, without realising that I was a student and that I was unable to do that unsupervised. After that, other nurses entered the room and they were able to assist. The decision was made to move the patient to a different area so that a blood transfusion could be commenced. So I quickly cleared the area of the bedside table and the patient's luggage so that they were able to leave the space. The challenge for me was that I felt completely useless in that situation, that since I was a student, I did not have much scope, but I ruminated on what more I could have done. I also had a tremendous amount of guilt that since I was in the room with her at the time of the bleeding, and I was somehow responsible in that she was in the wrong position, for example, and I should have known that, and I should have been able to reposition her. What made things worse was that there was no time after the event for my buddy to be able to do a debrief with me, so I had to go home carrying a lot of blame on myself. I overcame this challenge by going in early the next day to seek out a debrief with my educator, who advised me that I did not have any part in this complication and reassured me that by recalling the drop in the blood pressure and increase in the heart rate was actually really helpful, and that just by clearing the area so that the person was able to be transferred from the room was all that I could have been done, all that I could have expected to be do in that situation, which made me feel a lot better. One unique strength that I have is that I'm able to remain composed under pressure during clinical incidences or when dealing with complex patient behaviours. I can put aside stress of what may be a really critical situation unfolding and almost regroup with myself in my mind to be able to go into solution mode and think logically of the solution to the problem. So what's the problem? What's the outcome I want? What do I need to do to achieve this? What matters right now? What does not matter right now? And I'm able to do this without all the noise of stress in my head. If I feel I'm catastrophizing, I have the self-awareness to recognise this and just rein it in. Having this strength is relevant to the nurse's role because nursing is a team sport. It means I can communicate effectively with team members. By doing so, it contributes to the safety of the patient, the overall outcome of the incident, and helps those in the team who may not be coping so well with it. It helps to relieve their stress as well. The second strength that I have is that I feel that I am self-aware. I do well at understanding how I may be perceived by others with my actions or behaviour, and I change it where necessary so I don't offend people or cause conflict. It will be relevant to the graduate role as I will be the new person coming into a team of people whom I need to be able to get along with for both the safety of the patients that we share and also for the support that I'll rely on from them as well as for my own mental well-being. Being self-aware means that I can accept feedback more openly as well, and as a novice I will really rely on feedback, whether that's something that I want to hear or it's something that I don't want to hear, in order to improve. Self-awareness will play a strong role in fitting in and being liked within a new team, which will make me an even better team player. Without a doubt, I think the biggest challenge I see in my graduate year, specifically for the first few months, will be imposter syndrome, and perhaps a bit of a performance anxiety in my new role. Although I've been working as an enrolled nurse for 3 years, my experience has always been under the guidance of an RN, both at work as well as on student placement. I feel confident with my theoretical knowledge. However, being an RN is such a different role, and I think that no matter how confident I feel within myself, it will be different to transition from being so used to being the person asking for decisions and supervision to the person making the decisions and supervising others. It's just an extra layer of responsibility and accountability. I think a lot of people will have struggled with this, and to help me with this feeling, I'll connect with colleagues from this course and discuss how they are feeling, and maybe this might help normalise imposter syndrome for me. I'll also openly discuss with my peers. I think being vulnerable is a great way to conquer fear and build a rapport with people as well. Another way I will manage this is by using positive internal dialogue. So taking the time to reflect when I do something well, and then reminding myself that I'm actually very capable. I'll also remind myself that every single person I work with was once a graduate themselves. I'll be kind to myself by taking extra care to ensure that I do things thoroughly and logically before I act, so that I lessen any errors that I may make and that may sort of set me back and make me lose my confidence. But at the same time, I'll remind myself not to dwell on errors. Thanks for listening. I hope you enjoyed hearing a little bit about my motivations, aspirations, strengths, and personal struggles.